that are out there, not just for their lives, but for everyone else. And so I think people have been gracious, but some people are talking about whether or not they're going to.
Session scheduled for the fall of 2020. As you all know, we've learned to adapt to this new way of interacting with elected officials through this series of virtual briefings, and we've been able to have in-depth conversations with legislators on a number of topics important to the life sciences and our member companies. Before we get into today's meeting, I want to offer an immense thank you to the sponsors of this edition of Policymakers Live, Amgen and Biogen. Thank you, Amgen and Biogen, for helping make MassBio continue to advance our mission of making Massachusetts the best place in the world for the life sciences. I am so excited to introduce our guest here today. I want you to join me in welcoming Representative Hannah Kane to today's edition of Policymakers Live. Representative Kane is a Republican state representative representing the 11th Worcester District, which includes the communities of Shrewsbury and Westboro. I did say, yes, she's a Republican. It's exciting to have a Republican here. I think she may be the first Republican that we've had on our Policymakers Live show. She's the ranking minority member on the Joint Committee on Public Health. We all know how important that committee is to the life sciences industry. Representative Kane, we look forward to hearing your thoughts on the House's plan for the rest of the session and what initiatives you are considering as you grapple with the impact COVID-19 has had on the Commonwealth. Before we get into the question and answer period, how are you doing, Representative? How are things going? And welcome to our show.
Thank you so much for having me, Bob. I'm thrilled to be here with all of you. Things are, going as well as can be expected given everything that's going on in the world right now. And I think opportunities like these to be able to talk to you and, to understand what's going on with MassBio and its members is critically important. So I'm happy to have the opportunity to share a little time with you.
Well, thanks for being here. Before we get into that, hey, this legislative session has been like no other. Legislating remotely, the extension of a formal session past a July 31st deadline. What do you see as some of the challenges, but also some of the benefits of this new way of doing business?
Sure. Well, like every other industry, we needed to figure out how were we going to function given the pandemic. And so, we had never done anything like this in the history of the Massachusetts legislature, had to figure out a way to conduct our business, not all in the same room together. And it's a challenge. You have 160 members. Even when we're in the chamber, we're rarely sitting in our seats. We don't follow directions well. We're not disciplined. So moving on to a remote platform was, it had its ups and downs, but clearly was necessary. And the downside of it is, as you know, Bob, this is a relationship business.
Sure.
Much of the the business that gets conducted, certainly between colleagues, happens in those running into each other in the hallways, or a short conversation where you know, run across to Capital Coffee and to get something to eat. And so not having those opportunities certainly hinders, I think, some of our ability to be productive, but we're figuring out our ways around it. And, you know, certainly this is it for the near term in terms of how we're going to conduct ourselves.
Yeah, you bring up some wonderful points about interacting inside, you know, our state's capital with the relationships that are necessary, that need to be fostered to advance legislation, et cetera. But more importantly, I mean, how about the people who you work for, your constituents? How has constituent service been during COVID?
Certainly people have never needed us more. You know, my aide and I, certainly in the first few months, and probably only cutting back a little bit around the end of July, people were just constantly calling us, hit by unemployment, small businesses trying to figure out, certainly as the reopening regulations were coming on, you know, how they saw themselves in that, what their questions were. So people have been, you know, hit as constituents, not only by the pandemic and the healthcare concerns, but their economics. You know, are they going to have enough money to pay their bills? What's going to happen? And, you know, many people called, and it took some time on our end from the government's end, because the government, you know, had to scale. We had 50 people, I think, in our unemployment support services.
Oh, yeah.
You know, we had to scale that to over 1,200 in an incredibly short period of time, and we had to scale it off-site. These people weren't in an office space. That was challenging. So, you know, I think we've done as well as can be expected, but it's hard for people to understand how it can take time for us on the government side of things to respond to what their needs are.
Yeah. Before we get into COVID and talk about more of the current events, I want to talk a little bit historically about, since the first day you came into the legislature, you have been a true patient advocate. And for that, we're so grateful. And, you know, over the years, we've established, I mean, I love working with you. You're a terrific legislator and a real advocate for the life sciences industry, especially the rare disease industry, the rare disease community. In fact, this session, you sponsored legislation to improve patient access to clinical trials and also to create a Massachusetts Rare Disease Advisory Council, which is really brilliant, right? It's going to take the best place in the world for this industry and make it even better, not only to help keep us on top from an innovative standpoint, but think of what this does for patients, right? Can you tell us why you decided to champion these bills?
Yeah, I mean, for me, certainly, you know, when we're elected, we all come to the table with our life experiences. And for me, I had a daughter who was diagnosed around 12 years old with ankylosing spondylitis first, a form of arthritis, and then 6 months later diagnosed with Crohn's disease, which happens in about 15% of those cases where you have the double. And so, you know, we were spending a lot of time in the hospital. At the same time, my son had bone infections and was hospitalized for a period of time. My father-in-law had stage 4 cancer diagnosis, and my brother was diagnosed with MS, sort of all within a 12-month period of time. And, you know, certainly that impacted me personally, but the more time I spent in our healthcare settings and really understanding the challenges to folks who are diagnosed with something where it's not easy to diagnose, takes a long period of time, and when they are diagnosed, you know, there isn't that hope there that really should exist for anyone who's facing something that's life-threatening. And so for me, as both a parent and as a legislator, decided this was a focus. And I come at this, you know, I have a business degree from Boston University. And so I'm always trying to figure out, you know, how do we find solutions? How do we get to where we need to go? And I saw an opportunity to be an advocate and in an area that was really compelling to me on many levels.
Well, you know, we can't thank you enough for that. And when you think about, you know, one of the things that you and I connect quite a bit on is being parents of kids that have unmet medical needs. And I think there's nothing more powerful than that passion of a parent that is trying to help their child, and to live here in the place that is the best place in the world for solving these unmet medical needs. We're very fortunate. And these autoimmune diseases are so tricky and so challenges. And there's still so many unknowns that it's so important that, science can't do it on their own. It requires partnership. It's all you got. I mean, people have heard this hundreds, if not thousands of times when we talk about academia, industry, and government. Yeah. Working together. If we don't all work together, we're not going to continue to be the best. And that's why meetings like this that we're having today and the constant communication and partnership is so important, not just to drive the economy and create jobs here in Massachusetts, but help people like our children and so many others walking on this earth who are experiencing unmet medical needs. So thank you for that. And there's going to be the future is so bright for our kids, right? It really is. So thank God for that. As you know, COVID-19 has impacted every facet of daily life, but we have good news. Last couple of weeks, we heard great news coming out of Pfizer. This morning, we woke up to great news coming from Moderna. As you can tell, I'm getting a little excited right now, right? Think about this. In the past, it's taken anywhere from 4 to 10 years to invent new vaccines for novel viruses. We've been able to compress that down into less than a year, okay? 90 companies in Massachusetts proper right now are doing COVID-19 related research, whether it's in diagnostics, therapeutics, or vaccines. These two vaccines that are leading the way have strong ties to the Commonwealth of Massachusetts. So, hey, maybe this is an opportunity for us as an industry to brag, and for you as an elected official who plays a leadership role in public health to brag. We should be so proud of what's happening. That being said, we know now that vaccines are on the horizon, right there. Okay, close. We're talking, a small amount of time before these vaccines, 2, maybe 3, should be approved early into next year, if not late this year, okay? In your role as a member of the Joint Committee on Public Health, what do you see as some important next steps that our partners in government and the legislature can take as we look towards public health in 2021, specifically around vaccine distribution, right? It's one thing to have it. How do we get it out there?
Right. And I think, what has gone well during this pandemic is the fact that here in Massachusetts, we have figured out how to leverage partnerships, right? Like, we called on you, the governor called on you, help us with this issue regarding protective equipment, help us. How do we do this? How should we go about this? Where are the opportunities out there? And, likewise, understanding that we have the nexus of everything that is needed to determine a vaccine solution to this pandemic is here in Massachusetts. We have the leaders in life sciences and healthcare. And we have, I think, forward-thinking government. Again, we have clearly supported this industry. We understand its importance. And now that is paying dividends to us in terms of our response as a Commonwealth to the pandemic. I think part of the challenge is, as you mentioned, there are people out there who are concerned or unwilling at this point to accept a vaccine. And that's something that we need to do a lot of work on, not only as the folks who are developing these, but the partners in government who need to make sure that people understand how this is critical and can help get us back to a functioning economy and a hospital system that can sustain us over the long term instead of being overwhelmed. And I think we also, one of the bills that I filed last session was signed by the governor this past April, was a local public health bill. I served on a commission for 2 years looking at the way that we do local public health here in Massachusetts, which is unlike any other state in the nation, with 351 different boards of health, one for every city and town. We don't have an effective or efficient public health system. And you're seeing that now. You're seeing some of the challenges that we have, certainly in contact tracing, but that's going to be really important for vaccine delivery as well, making sure that we have a system across the Commonwealth in our cities and towns that can support the rollout of a vaccine and to make sure that they're speaking to their residents about the importance of participating in it. So we're doing some more work on that. I filed another bill with Vice Chair Ways and Means, Denise Garlick, and the Senate Chair of Public Health, Joe Comerford, to work on some of these issues to make sure that the robust system that we have here in the Commonwealth in terms of life science industry is also just as robustly supported at the local health level. And what that leads to, as you know, is disparities. And we're seeing the disparities happening, being illuminated by this pandemic. And again, there are bills that I have filed, that others have filed, to get to the root of some of these disparities in healthcare. And certainly the cancer clinical access bill that I filed is one directly. The Globe had an editorial yesterday, sadly didn't talk about my bill, but did illuminate.
Shame on them.
I
Shame
know,
on
right?
the Boston Globe.
They did get an email from me.
Yeah.
But, I think, for some people, seeing what's happening from the disparity perspective, they think this is new. It's not new. And it's not something we just started working on. We've actually had many pieces of legislation focused on addressing some of these challenges. And I think that's an area that we really need to focus on in this next session. What do we need to do to drive down and eliminate these disparities in healthcare access and the outcomes of healthcare? And the challenge right now certainly is we see a higher population of folks who are Black and Brown who are suspect of a vaccine. And so we have a lot of work to do to be tailored messages directly to that community about why this is safe. It's been tested. When it comes to market, it's going to be something that has gone through the rigorous process that other things have. And so I think sometimes we're fighting that amazing response that has occurred to this pandemic with people's concerns about, does speed equal some lack of safety, which we clearly know, having been this close to the life science industry, that that's not the case, but we have work to do on that.
Yeah, it really comes down to like a trust issue,
Certainly.
right? Like the certain components of the public don't trust government. They don't, and look at, hey, we represent the life sciences industry here. Pharmaceuticals are only 14% of the overall cost of healthcare, yet people think that we're the big, bad, evil empire, right? And think about it. We're trying to look at the resources and the effort that's gone towards, solving this public health crisis that we're in. And that's why I spend so much time talking to, C-level folks of these companies that are involved with this war against the virus, to say, like, we got to make sure we do everything right. We need to make sure that this vaccine, it's priced appropriately. People are compensated appropriately, but most importantly, it's deployed in a way that's fair and equitable, right? So it isn't just the haves and versus the have-nots in getting vaccinated. So again, there's going to be a huge public health awareness campaign that needs to happen so that, people do understand what's going on here. The efficacy that they're seeing out of this vaccine is like none other. And the safety profile is it's safe too. I mean, this isn't a political thing. This is a public health thing, and we need to continue to follow the science. That's so important. So thank you for being a champion in that area. Let's go over now to legislative business, slow between the weeks between primary and general elections. However, last week, the House finished debate on the FY 2021 budget.
Yep.
The Senate's scheduled to debate the budget this week, right? Yeah. It's going to be an exciting week in the Commonwealth of Massachusetts. And then the governor's hoping that the legislature can get the final recommendations to him by Thanksgiving. And that's a week from Thursday?
Right, which
right?
is...
Is this timetable, all right, former politician being skeptical, is this timetable realistic or not? I'm a little skeptical.
I'm skeptical we're going to get it to him by Thanksgiving. My guess is probably the week after Thanksgiving. I mean, I think, I want to give the Democratic leadership in both the House and the Senate a lot of credit. I think there were a lot of discussions, a lot of work that went into, how do we craft a budget knowing the safety net needs to be strong, given that we're also going to see reduced revenue coming in. So and I think, certainly on the House side, I was very pleased with the budget that came out. We, as you know, it's always interesting to see how many budget amendments get filed. It's certainly a game that occurs. We were limited, certainly to what we filed and certainly to what we got in this. And I think the Senate is taking the same tact and recognizing, the more we can stay close to the real areas of support that people need right now. One of the things that I'm involved in, I was a co-founder and I'm a co-chair of the First in the Nation Food System Caucus. We have 3 priorities, and one is food insecurity. And so we have advocated, I will tell you as well, that's the second largest caucus on Beacon Hill, second only to the Democratic caucus. But we are a bicameral, bipartisan group, and we've been doing a lot of work to make sure that food security was something in the budget, and that was there and very strong. And so, I want to give a lot of credit to the leadership for that. So I don't expect the normal sort of back and forth of a conference committee that would occur in a budget, which sometimes stretches out, especially the last few years, as you know, months on end.
Sure.
I do think it's going to turn around quickly, but I certainly think they probably need more than really 2 business days to do that going into the holiday week. So I suspect that we will be sending something to the governor in December, and that we perhaps might see in the next week or two a 2-week interim budget filed for December, just to bridge that timing gap needed.
How about the conference committees? There's all sorts of conference committees that have been deliberating this fall with just over 7 weeks left for formal legislative sessions. How do you envision the remainder of the year? Like what matters do you think will make it to the finish line?
Well, as you mentioned, we're usually not in session this time in our second year, and we agreed to extend it at the end of the July because of the budget, and certainly because we wanted to be able to respond to anything that was happening with the pandemic, but also because we have these 5 conference committees going. Some of them have been going for a longer period of time. The transportation bond bill, I think, is the furthest one in the past that we did. There's no real reason we can't get any of these things done. But from where I sit, certainly the healthcare conference committee is probably the most important one, really dealing with a lot of the factors around telehealth in particular. Some of the things, as what's the old saying, that don't ever let a good tragedy or challenge go to waste, right? And so, to respond, particularly when we had to shut a lot of the hospital work down, other than responding to the pandemic, people have seen that telehealth can work and how it works.
Yeah.
And so I think that's really important, that we are able to put into statute the pieces that we want to carry forward. And so that negotiation between the House and the Senate is critically important. It's probably the second most treacherous negotiation as well, going on, second only to police reform, which is one of the other conference committees. So those are the 2 that I think will probably take the most amount of time. But economic development, again, critically important, and climate is the 5th one. So we've got a lot of huge, big topic, important pieces of legislation that are in conference right now. And, we have until essentially the first week in January until we go into the next legislative session. So my guess is we're going to go in spurts. We run out the clock like only the Patriots can. And so I fully expect that we will be going to the last minute in January.
How about that game last night? Wasn't it awesome to see them win again? Right? It was.
What's awesome is watching everyone's posting like it's a new world today. Like nothing that we've been saying the last couple of weeks matters anymore because we won a game, so it's all new.
It's all good. And Baltimore's a great team, so that was awesome. But I must say, watching that game in my warm house as a season ticket holder, I was thinking, wow, another silver lining of COVID, right? We've talked about a couple like telehealth. I really had a silver lining moment saying, I'm glad I'm not standing in that rain right now watching this game. It was great watching it at home. We only have a few more minutes, Representative, but and this is something that typically isn't part of the current questions, but I think it's interesting having you on board with us here today. And, I get the opportunity quite a bit. And I did a meeting last week with governmental official folks from Connecticut. I've done it with folks from Texas and California and Kentucky and Indiana, where we talk about why Massachusetts has this magical environment for this industry. And now in light of what we're doing in the COVID-19 battle, it's shining a light on how amazing the innovation coming out of the Commonwealth is. And a lot of the talk goes back to how, the creation of the Life Science Initiative happened, or the Life Science Center happened under Mitt Romney, a Republican. Deval Patrick came in and said, okay, let's look at our strengths here in the Commonwealth, and created a more robust life science center with the life science initiative, the $10-year billion-dollar initiative behind it. He also looked at clean energy and high tech and the creative economy, other strengths. And he does 8 years as governor. In comes Charlie Baker, and boom, lo and behold, we do a 5-year, $500 million initiative, which is really amazing, right? It's like I tell people often, that continuity in government, and to have a bipartisan, amicable nature of things is more important than anyone would ever understand. We don't have this on a national level. What do you attribute the Republican versus Democrat ability to be civil, right? The civility and to be colleagues and collegial, right? How do you explain that as a Republican in Massachusetts?
I belong to Women in Government, which is the National Women's Foundation, and I hear that when I go to conferences as well. Certainly, even if going back to the opioid epidemic, how we responded here to that in Massachusetts, where other states were still debating whether or not there was even a problem. So I constantly am sort of faced with people wondering how we do it here in Massachusetts. And, I think there's two things. One, I think, we're aware of the commonalities that we have. I mean, I call it sort of the moderate middle. So whether you're, a moderate Republican or a moderate conservative, we approach things from understanding the middle matters, right? And it isn't the extreme things that keep us separated that we should be focused on. And I think, we saw that last year in terms of the value of education as well, which I think is something that underpins all of this. That's been another constant that has gone from administration to administration, the commitment to wanting to lead in education, and how that also is underpinning and supporting all of this innovation in the economy that we have here. But I think, the current speaker has done a very good job at trying to get to consensus as well, not only within, the Democratic Party, but certainly with the minority party as well, figuring out what the concerns are. And so a lot of times when you see things brought forward, they are things that have been worked on for a long time behind the scenes, and had a lot of the important dialogue that needs to occur. And quite frankly, if you look at what happens in other states and at the national level, why would we want to ever change the way that we operate here?
Yeah.
And so, would I love to see a little bit bigger of a Republican caucus at the State House? Absolutely. But what I'm most concerned with is people coming to work every day who share that same passion for wanting to make a difference here in the Commonwealth for the people who live here. And I think as long as we keep the residents of the Commonwealth, and we keep the understanding that government is both an important safety net for people, but it's also a really important group of people who can help break down barriers and support industry in critical ways that are needed. And if we all keep that focus, I think we're all going to keep doing the right thing here in the Commonwealth.
Wonderful words, Representative. Thank you so much. And, there's some multiple questions coming from the audience right now, just asking what is the best way to work with you in your office, especially in the areas to further discuss initiatives on communicating with the Black and Brown community and helping to get them on board as it relates to vaccines moving forward. So what recommendations would you give to the audience? What's the best way to contact you and your staff?
I would just contact me directly, hannah.kane@mahouse.gov. I do all my own emails. So you send something to me, I'm going to be the person who reads it. I would love to have that. I mean, again, there's many different bills that are there in the legislature that we need to advance. There's ones on maternal health, the disparities in maternal health, which is really important, a bill that I have been a co-sponsor of and has passed in the House. We're waiting for it in the Senate, but I would love to be able to work with anyone. So please reach out directly to me. And I can also connect folks with my colleagues who are taking leadership positions and helping with a lot of these conversations. The Women's Caucus, I'll give a plug to for. So a lot of this work that we're doing together, again, in a bicameral, bipartisan fashion, is designed to break down some of these barriers and eliminate the disparities.
That's wonderful. And to the folks out there, Susan Martin at MassBio will share all that contact information with everybody who's on board with the call as well in our policy working group. So ladies and gentlemen, please, on behalf of everybody here at MassBio and all of our member companies, Representative Kane, we can't thank you enough for all the work that you do, not just for our industry, but for patients. And, for me, I'm grateful to have you as a friend and someone who I truly enjoy the relationship. And as a fellow patient and parent advocate, we're always going to stick together on these issues. So again, thank you for all that you do for the Commonwealth of Massachusetts and for our industry. It means the world to us. It really does.
Thank you for the invitation to join you here today. I'm always excited to spend time with you, Bob, and your advocacy, your work as a relationship manager is exemplified by all of the success that the industry is having. And again, I want to thank everyone who works in the life science industry. I know that it is a critical point in time for all of us, and the work that you're doing, not only on COVID-19, but on all the other areas of discovery, is critical to the Commonwealth and to our country and our nation. So thank you.
Well, thank you. And ladies and gentlemen, that will conclude this episode of Policymakers Live. And I want to let you know that our final briefing for the fall of 2020 will be this Friday, November 20th at 11 a.m. Be sure to register. We're going to be spending some time with having a virtual briefing with Senator Joan Lovely, who's the Assistant Majority Leader in the Massachusetts State Senate. Again, we want to thank our sponsors for the fall series at Amgen and Biogen. This wouldn't be possible without their support. So folks, have a wonderful week. There's a lot to celebrate about this week. So get out there. I'm not just talking about the Patriots win. We're talking about another vaccine, great data, hopefully coming soon, right here out of the Commonwealth of Massachusetts. Until then, be well.
Thanks, Bob.